there are different types of Parkinsonian disorders, and of Parkinson's disease is the most important and typical disorder among the Parkinsonian disorders. And these patients need to be detected and treated early because they have a very good response to a medicine known as levodopa. Now, why there is Parkinson's disease? Because in the brain, a certain area of the brain, what is known as substantia nigra, does not secrete the normal amount of dopamine. So that is the problem. The dopamine is less in Parkinson's disease. Therefore, if you give medicines which can increase the dopamine in the brain, then the Parkinson's disease can be relatively controlled. Now, I'll give an example of a patient with Parkinson's disease. So this man you can see here, this is the tapping I'm telling him to do. It is very slow or irregular. A normal person should do is big tapping, opening and closing the hands. But in this patient, you can see here, there's a very slow movement he can do. This is known as alternating movements. Then his foot tapping is also not so much problem, but it is less than normal. And you can see his posture is stooped. He has a reduced arm swing. He has short steps. He has a tendency to fall, so he holds the wall. And this is known as a freezing. And if you give a visual cue, like what is lying on the ground, he can overcome it. Okay, so these are the classical examples of a patient who has Parkinsonism. But this patient has more of slowness and stiffness. Now you see this gentleman, this patient also has Parkinson's disease, but you soon see that his hands are all shaking like this. And in classical Parkinson's disease, one side is more affected, one side gets affected early than the other side. But you can see here what is known as tremor at rest, and also many of the Parkinson's patients can have tremor or shaking of the hands when in action, that is in front of the, just keep it in front of the body. This patient has tremor at rest and action tremor. This patient also will later develop difficulty in walking, slowness, but there are two main variants of Parkinson's disease. One is characterized by too much of slowness and stiffness, another is characterized by too much of shaking.